exam because pathology carries about more than 50% weight on your USMLE Step 1 exam. It covers the majority of the subjects integration in it. So making sure that the pathology is the strongest subject of yours is extremely important. So today I will give you all the tips and tricks that help you to do well on the day of the exam in your pathology. So first of all, you need to know that in the step 1, you will encounter multiple choice questions. And time management is a very important component. The question vignettes used to be very short back in the days, but as the time past 10 years, we have seen the question vignettes are pretty long. So in other words, I'm trying to say that you have to work on your time management. Especially the pathology questions are very wordy, so you have to balance the time so you don't run out of the time at the end of your each block. So making sure that you're learning your content, also practicing on your QBank questions is extremely important. Now, UWorld and Emboss and Kaplan, there are so many QBanks available in the market. Regardless, whichever the QBank you're using, try to start doing some questions in time mode everyday basis. So the time management should be no problem on the day of the exam for you, because when the time mode is on, we have noticed that it generates some sort of pressure, and that pressure impacts on the performance. And I heard from many students that they feel comfortable when they are doing questions in a tutor mode or untime mode, because that leaves the pressure off and they focus on the question. Yes, it's a very good way to do the questions, because that way you will understand how the writers are writing these questions, how they are integrating the component from one subject to another subject. But at the same time, you have to make sure that you are comfortable in the time mode. That's the way the exam will test you on the day of the exam. They're not gonna test you on the untimed or tutor mode. So make sure you are doing every day some questions in the time mode. Those students who do really well on the QBank, they are really good at identifying the distractors in the question vignette. Every question will carry some sort of distractor that leads you to pick the wrong answer. As you are doing questions everyday basis, whatever the content you learn, this will help you to identify those distractors. This will help you to recognize all the distractors in any given topic. So more questions you will be doing on the particular topic, more you will be comfortable to recognize these distractors, and that will help you on the day of the exam. Every time we read the question vignette, what we see, okay, this is the right answer. You pick it, you move on. But at the same time, practice to narrow it down. Why the A is right versus the B is wrong? Why the C is wrong? Is the D is wrong or right? So try to narrow down at least 1 to 2 choices, and then recognize why the one is right versus another. So practice to narrow down your answer choices and select the best possible answer. Okay, let's talk about the different areas in pathology. My friend, do not ignore the general pathology. Some students feel like it's one of the easiest area in the overall pathology, so you're going to perform well on the day of the exam. But the fact is that the way they compose the questions on the general pathology, it complicated. It gets so complicated. So make sure that you read general pathology, make sure that you do questions on general pathology. What are the areas in general pathology that you really should focus on? Here are some areas: cell injury and adaptation, necrosis, apoptosis, hypertrophy, hyperplasia. These are the areas that are easy to read, but when it comes to the questions, they get complicated. Okay, because they involve some sort of integration between other different subject, or they involve another organ system in it. Also the inflammation and repair, like acute versus chronic inflammation. Also, what is the healing process? So please make sure that you are strong in these areas. Next is the hemodynamics, edema, thrombosis, embolism. So these are the one fall under the general pathology, and also the neoplasia, the definitions of the neoplasia, like carcinogens, tumor markers, benign versus malignant tumors. What is the difference? How it can be integrated within the biochemistry, how you will see and recognize these in the slides. So make sure that you are comfortable in general pathology overall. Let's talk about the systemic pathology. Every organ system is important, but in each organ system there are some areas, some topics that those are really high yield on a step 1, And I would suggest that please make sure the topics that I'm going to mention now cover these topics again and again. Make sure that you're doing enough question on those areas. So let's talk about the cardiovascular system. Cardiovascular system, atherosclerosis, myocardial infarction, vascular diseases, these are extremely important. Review those from your review book, whichever book you're using for the USMLE preparation or the video series. Also review from the first aid. First aid is not enough for the step one. Some people say I'm going to study just first aid and I'm going to do well on the exam. That's the bad plan. Like, that plan leads you to the failure. So review the first aid for the sake of memorization. Okay, so the topics that I mentioned, I'm going to repeat again. Atherosclerosis, myocardial infarction, vascular disease. You have to know these really well. What is the pathology, how it's integrated with the different disciplines, what's the treatment, complications, and so on. Okay, so let's talk about the respiratory system. There are so many topics in the respiratory system, but these three, the one I'm going to mention, are really important. Pneumonia, okay, COPDs, and the lung cancers. You need to know these topics really well. Review from the review book, review from the first aid, then see how you can integrate these topics with the different discipline and subjects. Do questions. Every time you cover a content, do questions on specific covered content. So for example, you just studied COPDs. How about doing question on COPDs? For example, if you have just finished the lung cancers, do questions on the lung cancer. So I would suggest every time you cover something, go to the Q bank, do questions, read explanation. Even the correct questions, explanations, if you read, you will do well. Next is GI. Yeah, in the pathology, the GI section is not huge, but again, you need to make sure that you are able to understand these topics very well. So peptic ulcer, inflammatory bowel disease, and also the liver pathologies. So these are high yield on GI pathology. You can cover it from the pathoma if you have a really hard time to understand from the book. Pathoma videos are really well. He explained the topic in detail. So once you cover, then go back to the Q bank, do questions to see did you understand all the concepts. Okay, hematology. There are so many diseases in hematology, but these are the three that I would suggest that you should know really well is leukemia, lymphoma, and anemias. You got to cover these again and again. There will be so many questions on your actual exam between these three topics that I just mentioned. Anemias, leukemia, and lymphomas. Okay, when it comes to the kidney disease, there are several kidney diseases. Those are high yield. I mean, I would recommend cover kidney section overall. Every single topic is extremely important, and do not ignore acute and chronic kidney diseases because these will come back again and again in multiple disciplines. The endocrine system is combined with multiple organ systems, especially the reproductive system or the CNS and the cardiovascular system. So my recommendation, when you are reading the endocrine system, try to understand that how you can tie or integrate this particular topic that you're reading now with the different topic or different discipline or different organ system. So as soon as you will start understanding the integration part, your endocrine system becomes much easier. What are the important topics in the overall endocrine system? I would suggest diabetes, thyroid disease, and adrenal gland. Okay, neurology, stroke, neurodegenerative diseases, CNS infections. These are the important ones, and CNS tumors. So I would suggest when you cover these topics, these are a bit complicated. Many people don't love to study the neurology, and it's not very well covered, especially in the first aid as well as in pathoma. So if you have a strong understanding, then fine. But if you don't, I recommend going back to the Robbins and review it from the Robbins. Small section, but important one. Musculoskeletal. In the musculoskeletal section, you have to make sure that you cover and recognize the disease as well as its presentation in an image or in the radiological image. So first is arthritis. There are different topics can be covered and tested related to the arthritis. So cover your arthritis, understand its concepts, understand important elements, memorize the facts that you have to memorize first aid is really good. You got some pictures there. You can also find some pictures in Robbins. So review your musculoskeleton very well. So arthritis is one of the topic. Another one is the bone tumor and musculoskeleton deformities. So I suggest that these are the topics that you should cover very well. So the bone tumor have multiple variations as well as the age groups and complicated names, so easy to mix them. So I suggest make sure that you cover your bone tumors very well. Dermatology, the skin tumor is the very high yield topic. So make sure that you cover all things related to the skin tumor. Its presentation again, its complications, as well as how to differentiate between the skin tumors, as well as what is the treatment. Lastly, reproductive system. In the reproductive system, you should cover everything about the breast cancer, cervical cancer, and prostate. And if you cover all these what I mentioned, you should be good to go and do well on the actual exam. Let's talk about the recommended resources to do well on the pathology. I say that Pathoma videos, you follow the Pathoma video with the first aid book. Have the first aid book open. For example, you're watching the video on anemia. Have the first aid book open, annotate all the important elements into the first aid book. This way you will have everything in one place on the first aid book. Also, I have created a mind map book for you guys. So this will also help you to integrate the information into your brain very well. So I will leave the link of that book in this video. So make sure you check it out. It's an amazing way to look at each high yield disease and it's create its mind map, its complication itself, as well as what's the treatment and how you can integrate the information between the systems and subjects. So I would leave the link in the description for you to check it out. Beside the mind map book that I mentioned, besides the Pathoma, some people love to read the Gullian. Gullian is pretty good. Like, it's very detailed. It does have a lot of biochemistry in it, but again, the integration part I really love about Gullian. The way he wrote that book, it's extremely well written. So for the specifically USMLE Step 1, it's a little bit more than enough, but regardless, if you have graduated long time ago and you have forgotten all about the basic sciences, that's the tool you should use to cover your pathology. Do not ignore flashcards. Flashcards are the best way to recall the information that you have covered a few weeks ago or a few days ago. Anki is a really good tool. This way, the topics that you are making mistakes, they will come back again and again and again until you lock them into your long-term memory. I highly recommend that you should use some sort of tool that contains the flashcard. Let's talk about some of the techniques that you should adopt. One is active learning. So when you are reading something, constantly ask questions to yourself. What else you know about this particular topic? Active learning involves being present in the moment when you're reading. So when you're reading or when you're watching a video, your brain is not engaged with the different distracting thoughts. Okay, it comes with practice. So more and more you will practice to be in present mode, more and more you will be comfortable to stay in an active learning mode for a longer duration of time. I suggest that when you are reading from the book, don't study hours and hours. Give yourself a break after every 30 minutes. So 30 minutes laser sharp focus, then take 5 minutes break, come back and continue where you left off. This way you will be learning actively, you will recall better, it will get into the long-term memory. So don't study hours and hours, take short breaks. Every time you cover a topic that is very detailed and contain a lot of information, make sure that you close the book, close the video, and summarize the topic to your own words. Explain the topic to yourself in any simple format you can. Once you can explain the topic to yourself, that means you have enough information to start doing questions on that specific topic. But in case if you are unable to explain the topic to yourself, that means you don't have enough information about that particular topic, so you need to go back to your book or video to reread it again. We all have strong and weak areas. Some areas that we love to study because we are comfortable and we know those topics very well. Now, those areas that you are struggling, that's where your points are. That's where your score is. Those topics, I would recommend go back to them again and again, and that's what we call spaced repetition. Give yourself some time, couple of weeks, and go back to your weak areas. Now, having a steady plan is extremely important. Without a steady plan, my friend, you will be drifting from topic to topic and organ system to organ system. So if you have a steady plan, try to follow it strictly. And if you don't have a steady plan, I will drop the link in this video. Check it out. You can download the composed study plan that many students have already used and have done really well on their actual exam. So I hope you find this study plan useful. During your preparation, you will come across with stress and anxiety. It's very common. Every time you feel the burnout, you need to give yourself time off. Every time you are under a lot of stress, find an activity that calm you down. Having a deep breathing exercise, or go to the gym, go for a jog, watch movie, meet with friends, spend time with your loved ones and family. So make sure that you are not getting to the point that cause the burnout, which is not good, because that's the point where you want to study, you want to spend time in your preparation, but you are so tired at that time. Means having a good time off before you hit burnout is a good idea. So control your stress and anxiety level. Medical science evolve with time. It's always a good idea to spend some time during your preparation on research papers that recently has been published. Try to find out what advancement has been developed, what new things came on the surface. You never know that they might test your knowledge on the day of the exam on that new development in that given particular topic. Day of the exam is a challenging day. Day of the exam is not fun. It's a stressful day, right? So making sure that understand that the day of the exam, that the stress that you feel, it's normal. Everybody feels same way. Okay, you have passed many exams in the past, right? So you came across getting into the medical school, passing all these exams throughout the medical schools. Now this is just another exam, and you're feeling exactly what you have felt in the past. If you come across those stresses in the past, you cross those bridges. This is another bridge that you will pass this exam. You will move to the next phase of your life. So control your anxiety, control your stress on the day of the exam. You have to be calm. There will be questions on the day of the exam that you do not know the answer. Don't invest too much time on those questions that you don't know the answer. Flag them, move forward, complete the block and come back to the flagged questions and try to reread, try to recall, try to solve the questions the best you can. Again, prepare yourself in advance. Don't study a day before your exam. One day before your exam, you need to calm yourself, relax, rest, spend time with your loved one. This will help you on the day of the exam. I hope you enjoyed this video. Please do not forget to subscribe to this channel. I will be keep on posting new videos on related topics for the step preparation, for the match process, for red flags and clinical experience and so on. I will drop off some important links in the description of this video. Check them out, and I wish you guys all the best. And if you have any questions, just like always, reach out.